3 minutes ago, 7,400,000 people sit waiting. Britain's NHS waiting list just hit a number that would fill Wembley Stadium 82 times over. And this morning, as flu patients back hospital corridors at rates never seen before in December, 15,000 doctors made a choice that will define this winter. They left, not for another shift, not for another ward. They left the NHS entirely, prematurely, before retirement, before they should have. Britain is on edge tonight, and the ground beneath the health service is crumbling. Subscribe now, you won't believe what happens next. It started at 7:00 a.m. this morning, December 17th. Across England, from London's Royal Free Hospital to Manchester's massive NHS trusts, resident doctors, the backbone of Britain's healthcare system, walked out. Not for an hour, not for a day, for 5 full days. The 14th strike since March 2023. But this time, the timing couldn't be worse, because while doctors picket inside those same hospitals, 2,660 flu patients lie in beds every single day, the highest number ever recorded for this time of year. A 55% surge in just 1 week. Enough patients to fill 3 entire hospital trusts. And the peak? It hasn't even arrived yet. Welcome to Britain's winter nightmare. This is how 15,000 doctors left the NHS on life support. The warning signs were there for years, but no one wanted to see them. Dr. Sarah Mitchell had been an A&E resident doctor at St Thomas Hospital for years when she made the decision. It wasn't dramatic. It wasn't sudden. It was quiet, calculated, and heartbreaking. In September 2023, she handed in her resignation and booked a one-way ticket to Sydney. She was 31 years old. "I love the NHS," she told colleagues before she left, "but I can't survive on love alone." Sarah was one of 15,000 to 23,000 doctors who walked away from the NHS between September 2022 and September 2023. Not because they retired, not because they were forced out. They left prematurely before their time, taking with them years of training, expertise, and an estimated £1.6 to £2.4 billion in taxpayer investment that will now have to be spent replacing them. The British Medical Association's report, published in June 2024, laid it bare. For every doctor who leaves, the cost to replace them exceeds £300,000. But the real cost, the lost skills, the broken team dynamics, the patients who lose continuity of care, the junior doctors left behind to pick up the pieces. The exodus didn't start overnight. It built slowly, like pressure in a sealed container. Pay cuts, burnout, rotas so inflexible that doctors couldn't see their own families for weeks. Real-term wages slashed by nearly 30% since 2008. A generation of medical professionals who trained for a decade racked up tens of thousands in student debt, only to earn less than software developers fresh out of university. By early 2023, the frustration boiled over. In March, resident doctors, formerly called junior doctors, though many are experienced clinicians in their 30s and 40s, staged their first walkout. Then another. 11 rounds of strikes across 2023 and 2024. Each time, the government promised talks. Each time, talks collapsed. Then came the overseas doctors. The ones Britain recruited from India, Nigeria, Pakistan, Egypt, countries that trained them, only to watch them leave for the UK's better opportunities. For years, these internationally qualified doctors filled the gaps, propping up an understaffed system. By 2024, 42% of NHS doctors were trained abroad, up from just 12% in 1957. But in November 2024, the General Medical Council released a report that sent shockwaves through Westminster. 4,880 overseas-trained doctors left the UK workforce in 2024 alone, a 26% increase from the 3,869 who left the year before. The biggest year-on-year jump since the pandemic. The UK health services risk huge holes in the workforce if this trend continues, the GMC warned. But the trend wasn't slowing. It was accelerating. Dr. Aditi Sharma, who moved from Mumbai to Birmingham in 2019, was one of them. She lasted 5 years. "I thought the NHS would value my work," she said in a final interview before returning to India. "Instead, I felt overworked, underpaid, and invisible. I came here for opportunity. I'm leaving because I found none." The government tried to ignore it. Ministers spoke of record investment and more doctors than ever before. Technically true. NHS England had 47,000 more full-time equivalent doctors in August 2024 than in September 2015, a 45% increase. But the numbers masked a darker reality. They were hiring faster than they could retain. A revolving door. New recruits coming in, experienced doctors going out, and then winter arrived. By early December 2024, hospitals were already at breaking point. Flu season hit harder and earlier than anyone predicted. A new variant H3N2 subclade K tore through communities. Hospitalizations spiked. Norovirus cases surged by 35%. A&E attendances hit a record 2.35 million in November alone, over 30,000 higher than the previous year. Ambulance calls, 802,525 incidents, nearly 49,000 more than November 2023, and England called it a worst-case scenario. Professor Meghana Pandit, the NHS National Medical Director, issued a stark warning on December 11th. We are facing an unprecedented wave of super flu. The NHS is being pushed to the limit. But no one saw what was coming next. On December 10th, the government made an offer to resident doctors, more training places, a promise to address the jobs crisis, but crucially no pay rise for the current financial year. Health Secretary Wes Streeting called it a fair deal. The BIMA put it to a vote. Of the 55,000 resident doctors represented by the union, 35,107 cast their ballots. The turnout, 65%. The result, 83% rejected the offer. 5 days later, on December 15th, the BIMA announced strike action. December 17th to 22nd, 5 full days. Right in the middle of the worst flu surge in NHS history, Britain held its breath. The moment the announcement dropped, social media exploded. Within an hour, #NHS strike was trending across the UK. Within 3 hours, it had over 150,000 posts. The nation was splitting down the middle and the divide was brutal. How dare they strike during a flu crisis? One tweet read, shared 12,000 times. People will die because doctors want more money. Disgusting. Another. With 18,000 retweets, these doctors work 80-hour weeks for poverty wages while MPs vote themselves pay rises. They're not the villains here. The government is. The comment sections became war zones. Nurses versus doctors. Patients versus unions. The public versus itself. On the morning of December 16th, one day before the strikes began, Wes Streeting appeared on BBC Breakfast. His message was clear and cutting. This strike is dangerous, he said, looking directly into the camera. We are facing the most dangerous time of year. Flu is tearing through our hospitals like a tidal wave. And the BIMA is choosing right now to walk out. I urge resident doctors, vote for this deal and call off the Christmas strikes. The words hit like a hammer. Dangerous. Tidal wave. Christmas. Every phrase calculated to turn public opinion, but Dr. Jack Fletcher, chair of the BIMA's Resident Doctors Committee, wasn't backing down. In a press conference that same afternoon, he stood surrounded by exhausted-looking doctors still wearing their scrubs. We didn't choose this crisis, Fletcher said, his voice steady but strained. The government did. They've had years to fix this. Years to pay doctors fairly. Years to create enough jobs so newly qualified doctors aren't left unemployed after a decade of training. This is a totally avoidable jobs crisis and ministers keep recycling old promises instead of creating genuinely new solutions. He paused. The cameras clicked. If they can simply provide a clear route to responsibly raise pay over a number of years, and enough genuinely new jobs instead of recycled ones, then there need not be any more strikes for the remainder of this government. Westminster fell silent for exactly 4 hours. Then, chaos. At 2:47 p.m., a leaked internal memo from NHS England hit the press. The document, marked confidential for senior management only, painted a nightmare scenario, with resident doctors on strike during the flu surge. Elderly patients stuck in hospital beds would have no one to discharge them. Services would grind to a halt. A&E wait times could hit double digits, 10, 12, maybe even 14 hours for non-emergency cases. Striking doctors will leave the NHS struggling to discharge elderly patients as super flu rages through hospitals, the memo read. One line stood out. Staff covering will not get the Christmas break they deserve with their families. Within minutes, LBC, Sky News, and The Guardian were running the story. The narrative shifted again. Now it wasn't just about doctors. It was about nurses forced to cover, paramedics working double shifts, consultants cancelling family plans. The entire NHS being dragged into a fight it didn't choose. In Manchester, outside the Royal Infirmary, a 67-year-old woman named Margaret Ellis spoke to a reporter. She'd been waiting 4 hours for her husband's scan appointment cancelled because of the strikes. I understand they need fair pay, she said, her voice shaking. But my husband has cancer. He needs that scan. What are we supposed to do? Just wait and hope. Her words went viral. 2.3 million views by midnight. In London, a counter-protest formed outside Parliament. Medical students, retired doctors, NHS support staff, over 800 people holding signs. Pay doctors fairly. Stop the exodus. We stand with resident doctors. One sign, held by a young woman in a medical school hoodie, read simply, "Today it's them, tomorrow it's me." By December 17th at 7 a.m., the strike was underway. Hospital car parks emptied of resident doctors. Picket lines formed outside major trusts. In Birmingham, Liverpool, Leeds, Newcastle, the scenes repeated. Doctors in winter coats holding placards, their breath visible in the freezing air. Some held signs, others held cups of coffee, trying to stay warm inside the hospitals. The skeleton crews took over. Consultants scrambled to cover shifts. Nurses worked beyond their scope. Locum agencies received emergency calls, temporary doctors charging premium rates to fill gaps left by striking staff. NHS England's Emergency Operations Centre activated. Red alerts went out to hospital trusts nationwide. Prioritize life-threatening cases, postpone all non-urgent procedures, prepare for prolonged delays. And the flu? It kept spreading. By December 18th, day 2 of the strike, the flu hospitalization count hit 3,140 patients. The highest December figure ever recorded, up from 2,660 just a week earlier. The peak still hadn't arrived. On social media, the stories began pouring in. A mother whose child's surgery was cancelled. A man whose 84-year-old father waited 11 hours in A&E with chest pain. A woman who called 999 3 times before an ambulance arrived. But there were other stories too. Doctors sharing their pay slips, showing how, after tax and student loan repayments, they took home less than £2,000 a month. Resident doctors in their 30s still living with roommates because they couldn't afford rent in London. Physicians working 80-hour weeks, then being told there were no training positions available for them to progress. "I'm on strike because I have no future here," one doctor wrote on Twitter. "I trained for 10 years. I'm £80,000 in debt. And the NHS just told me there's no job waiting when I finish this year. So yes, I'm striking. Because what choice do I have?" The post got 94,000 likes. Polling data released on December 19th showed the nation split almost perfectly down the middle. 48% supported the strikes, 47% opposed them, 5% undecided. Britain was eating itself alive over a question no one seemed able to answer. Who is really to blame? And then, on the evening of December 19th, something broke. It happened at 6:34 p.m. A single tweet from an anonymous NHS consultant in Southampton. "Just lost a patient in A&E. 14-hour wait. Flu complications. We had no resident doctors to help assess. I'm broken. This didn't have to happen." The tweet was deleted within 20 minutes. But the screenshot had already spread to 400,000 people. NHS England couldn't confirm the details. Privacy laws prevented hospital trusts from commenting on individual cases. But the damage was done. The question everyone was asking, how many more? At 8 p.m. that same evening, Wes Streeting called an emergency press conference. He stood at the lectern in the Department of Health and Social Care, flanked by NHS England's chief executive Amanda Pritchard and Professor Meghana Pundit. His face was drawn, his tone different. "Tonight, I'm making a direct appeal to the BEMA and to resident doctors across this country," Streeting began. "We're in crisis. Not a theoretical one, a real one. Hospitals are full. Flu is at record levels. And every hour this strike continues. Patients are at risk." He paused. The cameras held on him. "I am prepared to return to the negotiating table tonight. Right now, no preconditions. We'll talk about pay. We'll talk about jobs. We'll talk about whatever it takes. But please, for the sake of your patients, for the sake of the NHS and the strike." It was the first time a health secretary had publicly begged a union to negotiate during active strike action in over a decade. Within 30 minutes, the BEMA responded. Dr. Jack Fletcher released a statement. "We welcome the Secretary of State's willingness to talk. But we've been here before. Talk without action means nothing. If the government is serious, we need a credible offer on the table, not promises, not recycled training posts, but real solutions to real problems." The statement continued. "Doctors are not the enemy. We're fighting for a health service that can survive. And right now, it can't." Between September 2022 and September 2023 alone, up to 23,000 doctors left prematurely. That's not a staffing problem. That's a crisis of confidence. Fix the system, and we'll end the strikes. No meeting happened that night. But behind closed doors, something else was unfolding. According to sources close to the negotiations, senior officials inside NHS England were privately admitting what they couldn't say publicly: the system was collapsing. Not because of the strikes. The strikes were just exposing what had been hidden for years. One leaked internal email, obtained by The Guardian on December 20th, was devastating. "We are managing patient flow with duct tape and prayers. Resident doctors striking isn't the problem, it's the symptom. We've been losing doctors faster than we can replace them for 2 years. Even if this strike ended tomorrow, we'd still be in crisis by February." The email was signed by a regional NHS director. The name was redacted, but the message was clear. The government had been lying. On the morning of December 20th, day 4 of the strike, Sky News released new polling data. Public support for the strikes had surged overnight. 54% now supported the doctors, up from 48% just 2 days earlier. The anonymous tweet, the leaked email, the health secretary's desperate plea, it all pointed to one unavoidable conclusion: the doctors were right. At 11:17 am. The Daily Mail, historically one of the most anti-strike voices in British media, published an editorial that stunned Westminster. "The doctors are right. The government must act." The piece, written by the paper's political editor, didn't mince words. "For too long, we've blamed unions for NHS failures. But the evidence is undeniable. Doctors are fleeing because we don't value them. We train them for a decade, saddle them with debt, pay them poverty wages, then act shocked when they leave for Australia, Canada, or Dubai. This isn't a strike problem. This is a leadership problem." By noon, the editorial had been shared 180,000 times. At 2:15 p.m., something unprecedented happened. 23 Conservative MPs, members of the government's own party, signed a letter calling for immediate negotiations and a fair pay settlement for resident doctors. Among the signatories, former Health Secretary Jeremy Hunt. "The exodus of medical professionals from the NHS represents a national emergency," the letter read. "We cannot recruit our way out of this if we cannot retain the doctors we already have. The time for half measures is over." Westminster was in freefall. The government's own backbenchers were breaking ranks. The media had turned. The public had turned. And the doctors? They were still on strike. At 4:00 p.m., 47 hours before the strike was set to end, the BEMA received a call, not from West Streeting, from someone higher, Downing Street. The conversation lasted 18 minutes. No recording was made public. But 2 hours later, at 6:00 p.m. on December 20th, a joint statement appeared on the BEMA's website and the Department of Health and Social Care's official page simultaneously. Talks will resume Monday morning, December 23rd. The BEMA Resident Doctors Committee and government officials will engage in mediated negotiations facilitated by ACAS, the Advisory, Conciliation and Arbitration Service. Both parties commit to negotiating in good faith toward a long-term resolution. The strike would continue through 7:00 a.m. on December 22nd as planned. But for the first time in 21 months of industrial action, there was something new in the air: hope, fragile, uncertain, but real. And then the numbers came in. NHS England released the latest flu data at 8:00 p.m. 3,280 patients in hospital with flu, the highest number ever recorded in the UK for any December week in history. The peak still hadn't arrived. Hospitals in Manchester, Birmingham, and London reported bed occupancy rates above 98%. Some trusts were operating at 102% capacity, patients in hallways, in storage rooms, anywhere space could be found. And through it all, the doctors who remained consultants, nurses, physician associates, the skeleton crews kept working. 16-hour shifts, 20-hour shifts. Some slept in on-call rooms and went straight back to the wards. One nurse at Liverpool Royal Hospital told reporters, "I'm exhausted. I'm angry, but I understand why they're striking. If we don't fix this now, there won't be an NHS left to save." That night, across Britain, 15,000 doctors slept knowing they'd return to work in less than 48 hours. But they also knew the fight wasn't over. Because the winter nightmare wasn't just about 5 days in December. It was about the 15,000 who already left, and the thousands more who were thinking about it. The strike ended at 7:00 a.m. on Monday, December 22nd. Resident doctors returned to their posts. The picket lines came down, but the hospitals they walked back into were unrecognizable. Bed occupancy remained above 95% at most major trusts. The flu count had climbed to 3,350 patients by Monday morning, still rising. Ambulances queued outside any departments, some waiting over an hour to offload patients. Surgery backlogs had grown by an estimated 8,000 procedures during the 5-day walkout. And the waiting list? Still 7.4 million. Still rising. In the corridors of St. Thomas Hospital in London, Dr. Amira Osman pulled a double shift on her first day back. She'd been on the picket line just 12 hours earlier. Now she was treating a 72-year-old man with pneumonia, a complication of the flu. He'd been waiting 9 hours. Striking was the hardest thing I've ever done, she told a colleague during a brief break. But staying in a system that's falling apart around us? That's harder. Across the country, that sentiment echoed. The strikes had ended, but nothing had been resolved. Not really. The mediated talks scheduled for December 23rd represented a chance, maybe the last one, for the government and doctors to find common ground. But trust was shattered. Goodwill was gone. What remained was exhaustion and a creeping sense that this winter was just the beginning, because the data doesn't lie. Between September 2022 and September 2023, up to 23,000 doctors left the NHS prematurely. The cost to replace them, £2.4 billion. But those are just the ones who already left. According to a survey conducted by the BIMA in November, 42% of resident doctors are actively considering leaving the NHS within the next 2 years. Another 31% say they're unsure if they'll stay. If those numbers hold, Britain could lose another 40,000 doctors by 2027. That's not a staffing shortage. That's a collapse. And it's not just resident doctors. The General Medical Council's report in November showed the overseas trained doctors, the ones Britain recruited to fill the gaps, are leaving faster than ever. The 4,880 who departed in 2024 represented a 26% jump from the year before. Many cited the same reasons British trained doctors gave: unsustainable workloads, inadequate pay, and a system that treats them as replaceable. Dr. Priya Menon, who moved from Kerala to Leeds in 2020, handed in her notice in November. She'll return to India in March. "I came here because I believed in the NHS," she said in her resignation letter, which was shared anonymously online. "I'm leaving because the NHS no longer believes in itself." The political fallout from the December strikes is still unfolding. The 23 Conservative MPs who broke ranks and called for fair pay settlements now face pressure from party leadership. Some are being quietly told to fall in line. Others are doubling down, insisting the NHS cannot survive without urgent reform. Labour has seized on the crisis. Shadow health officials are calling the situation the greatest workforce disaster in NHS history and demanding a public inquiry into why so many doctors are leaving. Polls show healthcare has surged to the #1 concern for British voters, above the economy, above immigration, above everything else. But inquiries take years. Doctors are leaving now. On December 23rd, as promised, talks resumed. West Streeting, BIMA officials, and ACA's mediators sat in a government building in London for 7 hours. No cameras, no press releases, just negotiation. When they emerged, both sides said only that talks were constructive and would continue after Christmas. It wasn't a deal, but it wasn't a breakdown either. For now, that's all anyone has. Meanwhile, flu cases continue to climb. NHS England warned on December 24th, Christmas Eve, that the peak may not arrive until early January, meaning the worst is still ahead. Hospitals are bracing for a post-Christmas surge as families gather, viruses spread, and A&E departments overflow once again, and the doctors, they're back at work, for now. But the question haunting the NHS isn't whether they'll strike again. It's whether they'll stay at all. In Australia, the average resident doctor earns 40% more than their UK counterpart. In Canada, 35% more. In the United Arab Emirates, many doctors earn double or triple their NHS salary, with better hours, lower costs of living, and no student debt crushing them. Britain trained them. Other countries are paying them. And the NHS is bleeding out because of it. This winter, 15,000 doctors left Britain's NHS on life support. But life support only works if someone keeps it running. And right now, across the country, thousands more doctors are looking at plane tickets, job postings overseas, and resignation letters they haven't sent yet. The winter nightmare isn't over. It's just beginning. And unless something changes, truly, fundamentally changes, the NHS won't survive to see another one. Tonight, in hospitals from Cornwall to Newcastle, doctors are finishing their shifts. Some will go home to families. Others will sleep in on-call rooms, ready for the next emergency. They'll save lives tonight, just as they did last night, and the night before that. But tomorrow morning, a few more will hand in their notice. A few more will book flights. A few more will join the 15,000 who already decided that loving the NHS isn't enough anymore, and Britain will wake up a little weaker, a little sicker, and a lot closer to the edge.